Question 1. The concept of confounding in epidemiological studies refers to a situation where an association between two variables is distorted due to a third variable, b. a statistical error made due to the small sample size, c. a methodological flaw that only occurs in cross-sectional studies, d. the relationship between two variables that is observed to be stronger when adjusted for potential confounders. Answer A. A situation where an association between two variables is distorted due to a third variable. Explanation. Confounding occurs when an extraneous variable, the confounder, is associated with both the independent and dependent variables, thus distorting the observed relationship between them. For example, in a study examining the relationship between alcohol consumption and lung cancer, smoking could be a confounder as it is associated with alcohol use and lung cancer risk. It is crucial for epidemiologists to control for confounding variables to ensure accurate results. Confounding can occur in any type of study, not just cross-sectional studies, and does not refer to errors made due to sample size. Question 2. Mr. Thompson, a public health officer, is conducting an outbreak investigation after noticing an increase in gastroenteritis cases in a local community. He starts by defining the cases, collecting data on symptoms, and determining the common exposure. After hypothesizing the source of the outbreak, what should be Mr. Thompson's next step? A. He should immediately recommend that everyone in the community undergo treatment for gastroenteritis. B. He should conduct further interviews and analyses to test his hypothesis and confirm the source. C. He should announce the outbreak to the media without any further investigation. D. He should wait for lab results before making any further decisions about the outbreak. Answer. B. He should conduct further interviews and analyses to test his hypothesis and confirm the source. Explanation. After identifying potential common exposures and forming a hypothesis, the next step in an outbreak investigation is to gather more data to test the hypothesis. This often involves conducting additional interviews with affected individuals, as well as conducting analytic studies, e.g., case control or cohort studies, to compare the rates of exposure among those affected versus those not affected. This helps confirm the true source of the outbreak before taking further actions. Immediate recommendations for treatment or public announcements should be based on evidence, not premature conclusions. Waiting for lab results might delay the necessary response, but further investigation must be done first to understand the source. Question 3. A study is being conducted to analyze the relationship between air pollution and cardiovascular disease. The study uses data collected from various cities, and the results show a strong association between higher levels of pollution and increased rates of heart disease. However, the study does not account for socioeconomic status, say, which is also linked to both pollution exposure and cardiovascular disease. What biases present in this study? A. Selection bias. B. Confounding bias. C. Information bias. D. Sampling bias. Answer. B. Confounding bias. Explanation. In this case, socioeconomic status is a confounder because it is associated with both the exposure air pollution and the outcome cardiovascular disease. If the study fails to account for the observed association between air pollution and heart disease may be distorted due to the effect of on both variables. Confounding bias occurs when an external factor is related to both the independent and dependent variables, thus misleading the results. Selection bias, information bias, and sampling bias do not specifically relate to the issue described in the scenario. Question 4. In a cohort study, researchers are examining the relationship between physical activity and the risk of developing type 2 diabetes. They observe that individuals who engage in regular physical activity have a lower incidence of type 2 diabetes compared to those who are sedentary. However, after controlling for other lifestyle factors such as diet, smoking, and alcohol consumption, the association weakens significantly. With most likely explanation for this change in the observed relationship? A. The association between physical activity and type 2 diabetes was due to chance and is not statistically significant. B. Physical activity may not have a direct causal effect on type 2 diabetes, and the initial association was confounded by other factors. C. The study design is inherently flawed, and the results cannot be generalized to the larger population. D. The weakening of the association suggests that physical activity is important for individuals with a family history of type 2 diabetes. Answer. B. Physical activity may not have a direct causal effect on type 2 diabetes and the initial association was confounded by other factors. Explanation. When the observed association weakens significantly after controlling for other factors such as diet, smoking, and alcohol consumption, it suggests that the initial association was confounded by these factors. Confounding occurs when an external variable influences both the independent physical activity and the dependent variable type 2 diabetes, leading to a distorted relationship. This does not necessarily mean that physical activity does not have an effect, but that the initial observed association may have been due to the influence of confounders. Thus, further analysis and more rigorous controls are needed to isolate the true causal relationship. Question 5. Dr. Williams is conducting an experiment to assess the efficacy of a new drug in reducing the incidence of lung cancer among smokers. Participants are randomly assigned to receive either the new drug or a placebo, and the results are analyzed at the end of the study. If the study finds a statistically significant reduction in the incidence of lung cancer in the treatment group compared to the placebo group, which of the following statements is the accurate? A. The results suggest that the drug is the only factor contributing to the reduction in lung cancer rates. B. Randomization guarantees that the drug caused the reduction in lung cancer incidence. C. The study shows an association between the drug and lung cancer reduction, but causality cannot be definitively established. D. The study proves that the drug is the definitive cure for lung cancer. Answer. C. The study shows an association between the drug and lung cancer reduction, but causality cannot be definitively established. Explanation. While randomized controlled trial RETS are the gold standard for establishing causal relationships, they cannot prove causality definitively due to potential issues such as confounding variables, biases, and uncontrolled factors. The significant reduction in lung cancer incidence in the treatment group to the placebo group indicates an association, but to establish causality, further steps such as replication of the results and ruling out other confounding factors are necessary. Randomization helps control for biases, but does not guarantee a causal link. Therefore, where RETS provides strong evidence for causality, they do not confirm it without additional corroborative evidence. Question 6. A study on obesity in children finds that there is a higher prevalence of obesity in urban areas compared to rural areas. The researchers suggest that this difference is likely due to a lack of access to healthy food and recreational opportunities in urban environments. However, the researchers did not account for the socioeconomic status of the participants, which may vary between urban and rural populations. What type of bias be introduced due to this oversight? A. Confounding bias. B. Information bias. C. Selection bias. D. Reporting bias. Answer. A. Confounding bias. Explanation. The failure to account for socioeconomic status introduces confounding bias. Is likely to be associated with both the environment, urban versus rural, and obesity, as individuals with lower SES may have lesser access to healthy food and recreational activities regardless of where they live. By not controlling for the researchers risk attributing the difference in obesity prevalence solely to living when in fact might be a more significant factor. Confounding bias occurs when an external variable influences both the independent and dependent variables, creating a distorted relationship. Question 7. Dr. Andrews is conducting a meta-analysis on the effectiveness of various smoking cessation programs. The meta-analysis includes studies that use different methodologies, participant populations, and intervention types. Dr. Andrews finds that the overall effect size is large, but the heterogeneity of the studies is also quite high. What does this high heterogeneity indicate about the results of the meta-analysis? A. The interventions are equally effective across all studies, and the high heterogeneity is due to random chance. B. The interventions have a consistent effect, but the studies included may not be methodologically sound. C. The studies included in the meta-analysis have significant differences, which could indicate that the interventions may not be equally effective across different populations or settings. D. The studies with high heterogeneity excluded from the analysis as they do not contribute to the overall result. Answer. C. The studies included in the meta-analysis have significant differences, which could indicate that the interventions may not be equally effective across different populations or settings. Explanation. High heterogeneity in a meta-analysis suggests that the studies included vary significantly in terms of methodologies, populations, and interventions. This indicates that the interventions may not be equally effective across all studies and the result not be generalizable. High heterogeneity can arise from differences in study design, intervention protocols, or participant characteristics. While meta-analysis can provide valuable insights by pulling results from different studies, high heterogeneity requires careful interpretation and often suggests the need for subgroup analyses or further investigation into the sources of variability. Question 8. In a randomized controlled trial RET testing, a new drug for hypertension, participants are assigned randomly to receive either the new drug or a placebo. During the study, some participants drop out and others fail to adhere to the treatment regimen. How might this affect the results of the study, and what steps should be taken to address this issue? A. The dropouts and non-adherence would not affect the results, as randomization eliminates bias. B. The non-adherence may result in a bias that could distort the effectiveness of the drug, and a per-protocol analysis should be conducted to account for this. C. Dropout and non-adherence bias would only be an issue if the dropout rate exceeds 20%. D. The effects of dropouts and non-adherence are insignificant and do not require specific analysis. Answer: B. The non-adherence may result in a bias that could distort the effectiveness of the drug, and a per-protocol analysis should be conducted to account for this. Explanation: while randomization helps mitigate selection bias, dropout and non-adherence can still introduce bias, as those who drop out or fail to adhere to the treatment may differ from those who remain in the study. This could distort the observed effectiveness of the drug, as the participants may not represent the broader population. A per-protocol analysis, which only includes participants who adhered to the protocol, is one method to address this issue, as it ensures that the analysis focuses on the population that received the intervention as intended. Dropout and non-adherence rates should be carefully monitored and considered when interpreting results. Question 9. In an outbreak investigation, epidemiologists observe a sudden increase in cases of influenza in a community. After conducting interviews and analyzing medical records, they determined that most of the affected individuals had attended a public event where a person with influenza symptoms was present. What is the most likely mode of transmission for this outbreak? A. Airborne transmission. B. Vector-borne transmission. C. Direct transmission. D. Indirect transmission via contaminated surfaces. Answer: C. Direct transmission. Explanation: direct transmission involves the spread of an infectious agent through direct contact with an infected person, such as through respiratory droplets when coughing or sneezing. Given that most affected individuals attended a public event where a symptomatic person was present, it is most likely that influenza was transmitted directly from the infected individual to others through close contact or the exchange. Respiratory droplets. Airborne transmission could also be a possibility, but is less common for influenza, which primarily spreads via droplet transmission. Vector-borne transmission and indirect transmission via contaminated surfaces are not consistent with the described scenario. Question 10. A researcher is conducting a study to investigate the association between air pollution and respiratory diseases in urban populations. After collecting data, the researcher observes that the prevalence of respiratory diseases is higher in areas with poor air quality, but the data does not account for the differences in smoking habits across these areas. What type of bias is likely present, and how can the researcher address it? A. Confounding bias, by controlling for smoking as a confounder in the analysis. B. Information bias, by collecting more accurate data on air pollution levels. C. Selection bias, by ensuring random selection of participants from each area. D. Reporting bias, by correcting the data collection methods to avoid participant misreporting. Answer: A. Confounding bias, by controlling for smoking as a confounder in the analysis. Explanation: confounding bias occurs when an extraneous variable, in this case smoking, is associated with both the exposure air pollution and the outcome respiratory diseases, leading to a distorted association. To address this, the researcher should control for smoking in the analysis, either by stratifying the data or including it as a covariate in a multivariate regression model. Information bias refers to inaccuracies in data collection, while selection bias pertains to how participants are selected for the study. Reporting bias occurs when there is differential reporting of exposure or outcome, neither of which is directly relevant to the scenario described. Question 11. A clinical trial investigates the effectiveness of a new cancer treatment compared to a standard treatment. The trial is designed as a double-blind, randomized controlled trial (RET) to minimize bias. However, after the trial, the researchers find that the participants who received the new treatment were more likely to report side effects than those who received the standard treatment. Which of the following factors is most likely to respond? For the increased reporting of side effects in the new treatment group, A. Observer bias, due to the researchers' expectations of the treatment's effects. B. Recall bias, due to participants' differing abilities to remember side effects. C. Social desirability bias, where participants in the new treatment group want to please researchers by reporting more side effects. D. Reporting bias, due to the trial design influencing the recording of side effects. Answer: B. Recall bias, due to participants' differing abilities to remember side effects. Explanation: recall bias occurs when participants' ability to remember and report information is influenced by their treatment group. If individuals in the new treatment group are more aware of the treatment they are receiving or have more attention drawn to their side effects, they may be more likely to recall and report those side effects compared to those receiving standard treatment. This is form of information bias, where the accuracy of the data is distorted based on the group to which the participant belongs. Question 12. In a cohort study, researchers examined the relationship between a high-fat diet and the incidence of heart disease over a 10-year period. The study finds that individuals who consume a high-fat diet have a significantly higher risk of developing heart disease compared to those who consume a low-fat diet. However, the researchers did not account for physical activity levels, which may influence both diet and heart disease risk. What bias is introduced due to this oversight? A. Confounding bias. B. Selection bias. C. Information bias. D. Reporting bias. Answer: A. Confounding bias. Explanation: confounding bias occurs when an unmeasured variable, in this case physical activity, is related to both the exposure high-fat diet and the outcome heart disease. Physical activity could independently affect the risk of heart disease, and it could also be related to dietary habits. Without controlling for physical activity, the observed association between a high-fat diet and heart disease may be distorted, leading to an overestimate or underestimate of the true effect. Question 13. A study is conducted to assess the association between socioeconomic status and the likelihood of developing asthma in children. The researchers collect data from both urban and rural areas and find that children in urban areas have a higher incidence of asthma compared to children in rural areas. However, the study does not consider air quality in the urban areas, which could affect asthma rates. What is the most likely explanation for observed findings? A. The higher incidence of asthma in urban areas is due to differences in air quality, which was not accounted for in the study. B. Says a direct causal factor for asthma development in children, regardless of environmental factors. C. Air quality is not a significant factor in asthma development in children, and the observed differences are purely due to say. D. The study design is flawed, and the results cannot be interpreted without account confounding factors such as genetics. Answer: A. The higher incidence of asthma in urban areas is due to differences in air quality, which was not accounted for in the study. Explanation: the failure to account for air quality in the study introduces confounding, where a third variable, air pollution, affects both the exposure urban environment and the outcome asthma. Urban areas tend to have worse air quality, which is a known risk factor for asthma. The observed higher incidence of asthma in urban children is likely due to environmental factors such as air pollution, rather than solely socioeconomic status. Thus, controlling for air quality is essential to better understand the relationship between SARS and asthma. Question 14. Dr. Anderson is analyzing the effectiveness of a new drug for managing chronic pain. She notices that patients who were prescribed the drug reported higher levels of pain relief than those who received a placebo. However, she also observes that the patients in the drug group were more likely to have higher baseline levels of pain compared to those in the placebo group. What type of bias is most likely influencing the results of this study? A. Confounding bias. B. Selection bias. C. Information bias. D. Performance bias. Answer: B. Selection bias. Explanation: selection bias occurs when participants are not randomly assigned to treatment groups, leading to systematic differences between the groups. In this case, if the patients in the drug group had higher baseline levels of pain, the comparison between the drug and placebo groups may not be valid. Higher initial pain levels could influence the reported effectiveness of the drug, making it appear more effective in the treatment, even if the drug's actual efficacy is not greater. Randomization should ensure that participants with varying baseline pain levels are equally distributed between the groups to avoid selection bias. Question 15. In a retrospective case control study on breast cancer, researchers find a higher frequency of alcohol consumption among women diagnosed with breast cancer compared to healthy women. However, the study did not account for family history of breast cancer, which is a known risk factor. What type of bias may arise from this oversight? A. Recall bias. B. Confounding bias. C. Selection bias. D. Observer bias. Answer: B. Confounding bias. Explanation: confounding bias occurs when an extraneous variable, in this case family history of breast cancer, is associated with both the exposure alcohol consumption and the outcome breast cancer, distorting the observed relationship. Family history of breast cancer is a known risk factor that could influence both alcohol consumption and the likelihood of developing breast cancer. Without controlling for this confounder, association between alcohol consumption and breast cancer may be overestimated or underestimated. Question 16. A study seeks to examine the relationship between physical activity levels and cardiovascular health in older adults. The researchers find that those who engage in regular physical activity have better cardiovascular health. However, the researchers only recruited participants who were already members of a fitness center. What type of bias does this study design most likely introduce? A. Selection bias. B. Confounding bias. C. Information bias. D. Reporting bias. Answer: A. Selection bias. Explanation: selection bias occurs when the sample chosen for the study is not representative of the general population, leading to results that may not be generalizable. In this case, by recruiting only individuals who are already members of a fitness center, the study may only capture individuals who are more health conscious or physically fit, which could skew the results. These participants are likely to be more active. General population and their cardiovascular health may be better as a result of factors unrelated to the specific physical activities being studied. Question 17. A researcher is conducting a cross-sectional study to investigate the prevalence of hypertension in a population. The study participants are asked to report their current blood pressure readings, and the data is then used to calculate the prevalence of hypertension. What potential limitation does this study design have regarding causality? A. Cross-sectional studies are not suitable for establishing causal relationships, as they only capture data at a single point in time. B. Cross-sectional studies are highly susceptible to confounding bias, which makes them unreliable for causal inference. C. Cross-sectional studies have a built-in control group, allowing researchers to draw causal conclusions. D. Cross-sectional studies can establish causality if the study is done with a large enough set. Answer: A. Cross-sectional studies are not suitable for establishing causal relationships, as they only capture data at a single point in time. Explanation: cross-sectional studies are descriptive studies that assess the status of a population at a single point in time. While they can provide valuable information on the prevalence of a condition, they do not allow researchers to establish causal relationships. This is because the exposure and outcome are simultaneously, making it difficult to determine whether one variable causes the other. Longitudinal or experimental studies would be needed to establish causality. Question 18. A hospital implements a new protocol to reduce the incidence of surgical site infections (SSIS). After the protocol is implemented, the hospital reports a significant decrease in SSIS. However, the hospital also recently upgraded its sterilization equipment and improved its staff training. Which of the following best describes the potential limitation of the study? A. Confounding bias, as the improvements in sterilization equipment and training may have influenced the outcome. B. Information bias, as the hospital may have misclassified the number of SSIS. C. Recall bias, as patients may not accurately remember whether they developed an SSI. D. Selection bias, as the study may not have included a representative sample of surgeries. Answer: A. Confounding bias, as the improvements in sterilization equipment and training may have influenced the outcome. Explanation: confounding bias occurs when an extraneous factor, in this case improvements in sterilization equipment and staff training, influences both the intervention, the new protocol, and the outcome (SSIS). Since both the protocol and the improvements in sterilization and training were implemented at the same time, it is difficult to determine whether the decrease in SSIS was due to the new protocol, the improvements in sterilization, or a combination of both. To address this issue, a more controlled study design or statistical control for these factors would be needed. Question 19. A randomized controlled trial RET on a new drug for treating depression finds that the drug is effective in reducing symptoms compared to a placebo. However, a subset of participants in the drug group reports significant side effects that were not anticipated by the researchers. How should the researchers address these unanticipated side effects in the analysis of the trial? A. The side effects should be ignored as they are not related to the primary outcome of depression reduction. B. The side effects should be reported and analyzed separately as they may influence the overall effectiveness of the drug. C. The side effects should be ignored unless they are severe enough to lead to discontinuation of the drug. D. The side effects should be excluded from the analysis to maintain the integrity of the trial results. Answer. B. The side effects should be reported and analyzed separately as they may influence the overall effectiveness of the drug. Explanation. While the primary outcome of the trial is the reduction in depression symptoms, the unanticipated side effects must be reported and analyzed separately as they could significantly impact the overall assessment of the drug's effectiveness and safety. Side effects may influence participant adherence to the drug, and analyzing them provide more comprehensive understanding of the drug's risks and benefits. Excluding or ignoring side effects would provide an incomplete and potentially misleading interpretation of the trial results. Question 20. The study investigates the relationship between education level and the likelihood of developing heart disease. Researchers find that individuals with higher education levels are less likely to develop heart disease. However, the study fails to account for physical activity, which is known to be related to both education level and heart disease risk. What type of bias does this oversight introduce, and how can it be addressed? A. Confounding bias, by controlling for physical activity in the analysis. B. Information bias, by ensuring that physical activity is measured accurately. C. Selection bias, by randomly selecting participants from both high and low education levels. D. Reporting bias, by ensuring participants accurately report their education level. Answer. A. Confounding bias, by controlling for physical activity in the analysis. Explanation. Confounding bias arises when a third variable, physical activity, is associated with both the exposure education level and the outcome heart disease, potentially distorting the observed relationship. To address this bias, the researcher should control for physical activity either by adjusting for it statistically or including it as a covariate in the analysis. So the researcher can isolate the true effect of education level on heart disease risk independent of the confounding influence of physical activity. Question 21. A cohort study investigates the association between high dietary sodium intake and the development of high blood pressure over 20 years. The study finds a statistically significant positive association between sodium intake and high blood pressure. However, the study fails to account for alcohol consumption, which is known to be related to both sodium intake and the risk of hypertension. What is the primary source of bias in the study, and how can it be corrected? A. Confounding bias, by adjusting for alcohol consumption in the analysis. B. Information bias, by ensuring that sodium intake is accurately measured. C. Selection bias, by ensuring random sampling of participants. D. Measurement bias, by using more accurate tools to measure high blood pressure. Answer. A. Confounding bias, by adjusting for alcohol consumption in the analysis. Explanation. The primary source of bias in this study is confounding bias because alcohol consumption is associated with both high sodium intake and the risk of developing high blood pressure. To correct this bias, researchers need to adjust for alcohol consumption in their analysis either through statistical methods or by including it as a covariate to isolate the effect of sodium intake on blood pressure. Question 22. A randomized controlled trial, RET, evaluates the efficacy of a new vaccine in preventing a viral infection. The study finds that the vaccine significantly reduces the risk of infection. However, there is a higher dropout rate among the vaccine group compared to the placebo group. How could this dropout affect the validity of the study's conclusions, and what steps can the researchers take to address it? A. The dropout rate could introduce selection bias, as those who dropped out may differ significantly from those who remained. Researchers should conduct an intention to treat analysis to include all participants. B. The dropout rate could introduce measurement bias, as missing data may lead to inaccurate results. Researchers should use data imputation methods to fill in missing data. C. The dropout rate could introduce confounding bias as participants dropped out may have had underlying health conditions. Researchers should match participants based on health status. D. The dropout rate will not affect the validity of the study because it is randomized, and randomization ensures balanced groups. Answer A. The dropout rate could introduce selection bias, as those who dropped out may differ significantly from those who remain. Researchers should conduct an intention to treat analysis to include all participants. Explanation: the dropout rate in one group is a form of selection bias, as the characteristics of participants who drop out may differ from those who remain. This can lead to an overestimation or underestimation of the treatment's effect. To address this issue, researchers should use an intention to treat analysis, which includes all participants in the analysis based on their original group assignment, regardless of whether they completed the study. This approach helps preserve the randomization process and reduces bias. Question 23. A study investigates the relationship between smoking and lung cancer by collecting data from patients who have already been diagnosed with lung cancer cases and comparing them to healthy individuals' controls. The researchers find a significant association between smoking and lung cancer. However, the study only includes individuals who have been diagnosed with cancer in a hospital setting, excluding individuals diagnosed in a primary care setting. What type of bias does this introduce, and how can it affect the results? A selection bias. By excluding individuals diagnosed outside of the hospital, the study may not be representative of the entire population, potentially affecting the generalizability of the findings. B. Information bias. By relying on patient self-reports of smoking, the study may not accurately capture the exposure to smoking. C. Confounding bias. By not adjusting for other variables such as occupational exposure to carcinogens, association may be distorted. D. Reporting bias. By excluding participants who are less likely to report their smoking history, the study may yield inaccurate results. Answer A. Selection bias. By excluding individuals diagnosed outside of the hospital, the study may not be representative of the entire population, potentially affecting the generalizability of the findings. Explanation: selection bias occurs when the sample is not representative of the broader population, leading to skewed results. By excluding individuals diagnosed outside of the hospital setting, the study may overrepresent demographics, e.g., those with more severe cases of lung cancer who seek hospital care, and underrepresent others, affecting the generalizability of the findings. To correct for this, the researchers should ensure the sample includes a more representative cross-section of individuals with lung cancer. Question 24. The study examines the impact of a new drug on reducing cholesterol levels in patients with high cholesterol. The study is conducted in a highly controlled clinical environment, and the participants are closely monitored. After 6 months, the researchers report that the drug significantly reduced cholesterol levels. What is a major limitation of this study design in terms of generalizing the findings to the broader population? A. The study does not account for potential differences in adherence to the treatment outside of a controlled setting, limiting its external validity. B. The study is subject to measurement bias because cholesterol levels may be inaccurately measured in clinical settings. C. The study lacks a control group, making it impossible to determine the drug's effectiveness. D. The study design is too simplistic as it only considers cholesterol levels and not long health outcomes. Answer A. The study does not account for potential differences in adherence to the treatment outside of a controlled setting, limiting its external validity. Explanation: while the drug may have shown effectiveness in a controlled clinical setting, the findings may not generalize to the broader population where adherence to the treatment may vary. In real-world settings, patients may not follow the treatment regimen as strictly, which could influence the drug's effect. Therefore, the study's external validity generalizability to real-world situations is limited. Question 25. In a clinical trial investigating a new drug for treating depression, patients are asked to rate their mood on a scale from 1 to 10 every week. However, patients in the drug group tend to report more positive moods than patients in the placebo group, even though both groups experience similar changes in symptoms. What type of bias may be influencing these results? A social desirability bias. Patients may feel pressured to report better moods to please the researchers or conform to expectations. B. Selection bias. The patients who were chosen for the drug group are inherently different from those in the placebo group. C. Observer bias. The researchers' expectations may influence the way they interpret patient responses. D. Recall bias. Patients may have difficulty accurately recalling their mood states previous weeks. Answer A. Social desirability bias. Patients may feel pressured to report better moods to please the researchers or conform to expectations. Explanation: social desirability bias occurs when participants report what they believe is the socially acceptable or desirable response rather than their true feelings or behaviors. In this case, patients in the drug group may feel pressured to report better moods to please the researchers or to meet expectations. Effectiveness of the drug. This can skew the results and make the drug appear more effective than it actually is. Question 26. A researcher is studying the effects of a new diet on weight loss. The study finds that individuals who followed the diet lost more weight than those who did not. However, the study did not account for participants' baseline activity levels, which are known to influence weight loss outcomes. What potential issue does this oversight introduce, and how should the study be improved? A. Confounding bias. The study should adjust for baseline activity levels to isolate the effect of the diet on weight loss. B. Selection bias. The study should randomly assign participants to diet and control groups to avoid systematic differences. C. Information bias. The study should ensure that participants' weight loss is measured accurately. D. Recall bias. The study should rely on objective measures of weight loss rather than self-report participants. Answer A. Confounding bias. The study should adjust for baseline activity levels to isolate the effect of the diet on weight loss. Explanation: confounding bias arises when a third factor, in this case baseline activity levels, is related to both the exposure of the diet and the outcome weight loss, potentially distorting the observed association. To address this, the researcher should control for baseline activity levels, either by measuring them directly or including them as covariates in the analysis to better isolate the true effect of the diet on weight loss. Question 27. A hospital implements a new protocol to reduce the incidence of hospital-acquired infections. After the protocol is implemented, the hospital reports a significant decrease in infections. However, there was also a simultaneous improvement in hospital cleanliness and infection prevention training. What is the most likely explanation for the observed decrease in infections? A. The decrease in infections is likely due to a combination of the new protocol, improved cleanliness, and enhanced training. B. The decrease in infections is entirely due to the new protocol, and the improvement in cleanliness and training is irrelevant. C. The decrease in infections is due to an unmeasured variable, such as changes in patient demographics. D. The decrease in infections is likely a result of confounding bias, where the effect of the protocol is obscured by other factors. Answer A. The decrease in infections is likely due to a combination of the new protocol, improved cleanliness, and enhanced training. Explanation: the observed decrease in infections is likely the result of multiple factors working together. The new protocol, combined with improvements in hospital cleanliness and infection prevention training, likely contributed to the reduction in infections. To understand the true effect of the new protocol, further studies isolate each factor's contribution would be necessary. Question 28. A study investigates the relationship between caffeine consumption and sleep quality among college students. The study finds that students who consume more caffeine tend to report poorer sleep quality. However, the study did not account for other factors such as stress, which is also known to affect sleep quality. What type of bias does this oversight introduce, and how can the study be improved? A. Confounding bias. The study should control for stress levels to better understand the relationship between caffeine and sleep quality. B. Information bias. The study should ensure that sleep quality is accurately measured using objective tools rather than self-reports. C. Selection bias. The study should ensure that students from different socioeconomic backgrounds are equally represented. D. Measurement bias. The study should use more instruments to assess caffeine consumption. Answer A. Confounding bias. The study should control for stress levels to better understand the relationship between caffeine and sleep quality. Explanation: confounding bias occurs when a third variable, such as stress, influences both the exposure caffeine consumption and the outcome sleep quality. To address this, the researchers should control for stress in their analysis to ensure that the observed relationship between caffeine consumption and sleep quality is confounded by this unmeasured variable. Question 29. A randomized controlled trial (RET) is conducted to compare the effectiveness of two different weight loss diets. The study finds that diet A results in greater weight loss than diet B. However, participants in diet A also tend to have higher levels of physical activity than those in diet B. What type of bias does this introduce, and how can the results be adjusted? A confounding bias. By adjusting for physical activity levels in the analysis, the true effect of the diets can be isolated. B. Selection bias. By randomly assigning participants, the differences in physical activity levels can be eliminated. C. Measurement bias. By using inaccurate tools to assess physical activity, the study results may be distorted. D. Recall bias. By relying on self-reported physical activity, the results may be influenced by participants' memory. Answer: a confounding bias. By adjusting for physical activity levels in the analysis, the true effect of the diets can be isolated. Explanation: confounding bias occurs when an external factor, in this case physical activity, influences both the exposure diet and the outcome weight loss. Since the participants in diet are more active, the differences in weight loss may be due to their higher activity levels rather than the diet itself. To address this, research should adjust for physical activity in the analysis, either by measuring it directly or by including it as a covariate to better isolate the effect of the diet on weight loss. Question 30. A cross-sectional study investigates the association between sleep duration and mental health among adolescents. The study finds that adolescents who sleep less tend to have higher rates of anxiety and depression. However, the study cannot determine whether poor sleep causes mental health problems or if mental health problems lead to poor sleep. What is the main limitation of this study, and how could it be addressed in future research? A lack of causal inference. A longitudinal study could be conducted to track changes in sleep and mental health over time to establish causality. B. Information bias. The study should use objective measurements of sleep duration, such as actigraphy, instead of relying on self-reports. C. Selection bias. The study should ensure that a representative sample of adolescents is included from various schools and regions. D. Measurement bias. It should ensure accurate and consistent diagnosis of anxiety and depression using standardized tools. And so a lack of causal inference. A longitudinal study could be conducted to track changes in sleep and mental health over time to establish causality. Explanation. A cross-sectional study can only demonstrate associations, not causality. To determine if poor sleep causes mental health problems or vice versa, researchers would need to conduct a longitudinal study that tracks changes in both sleep and mental health over time. This would allow for better understanding of the directionality of the relationship